cases. For more, we're joined by the head of the Biosecurity program and Professor of Global Biosecurity at the Kirby Institute at the University of New South Wales, Rana Mcintyre. Nice to meet you over Skype, Raina. How are you tonight?
I'm good, thanks.
We see these numbers go up all the time. We saw the Deputy CMO there saying he hasn't got a crystal ball, but do you see a pattern emerging here?
Yes, so I've looked at the daily number of cases and looked at the epidemic curve, and we're very much on the upward trajectory. So the epidemic has not peaked in Australia yet, which means that things will get worse in the next week and the week after. To some extent, it depends on what happens from here on in terms of the measures that we take. But I'm expecting cases to start increasing quite rapidly.
We saw the Prime Minister and the Treasurer there today saying that there's going to be a ban on all non-residents coming into Australia. And the Prime Minister said, like, the majority of cases that we've seen, he said about 80% of the cases we've seen in Australia are either the result of someone who has contracted it overseas or who has had direct contact with someone who's returned from overseas. What do you think of this measure? Is it enough or too late?
Yes, so travel restrictions are really important because travel is the major vector for transmission of infection around the world. So Australia has been very strong on the border control and travel restrictions, and every little bit will help because it's now very widespread globally.
Well, you just said to me it depends what we do from here on, whether or not that curve really goes straight up or whether we can realise that we've started to flatten the curve. So what's your instinct where we sit tonight?
Well, there's 4 things that we can do. In the absence of a vaccine, there are 4 things we can do to reduce the impact. The first is we have to identify every case and make sure there's no infectious people in the community who are transmitting.
And are we testing enough? Just before you go to 2, are we testing enough to do that?
I probably can't comment on that. But the second issue is that we need to track all their contacts and make sure that they're quarantined for 2 weeks and then monitored for symptoms. And if they develop symptoms, they're tested and moved away into isolation. Noting that the term isolation actually technically refers to sick patients, whereas quarantine refers to well people who are at risk of becoming sick. Mm-hmm. The third thing we can do is the travel restrictions. And the fourth thing we can do is the social distancing measures, which is anything you can do to reduce the amount of contact between people in society. And any measures you can take, it doesn't have to be an all or nothing phenomenon. There are lots of things that you can do. People can personally increase the social distancing, reduce the kind of social activities they might normally go to. And but then there's mandated types of social distancing, which is like the ban on gatherings of certain sizes, which we've heard about, 100 indoors, 500 outdoors. We cancelled the Melbourne Grand Prix, and that was a very good move. So those are the kinds of social distancing measures.
I guess, Raina, everybody's desperate for people like you to give them a definitive answer, right? Which is, when the government says we'll step up measures when the numbers go up, is that bolting the door after the horse is gone, right?
So the thing about epidemics, they're different from other diseases. So with chronic diseases, you often have months or years to think about your policy. You've got the luxury of deliberating and really fine-tuning your response. But with an epidemic, they rise exponentially. So the case, you'll probably see a doubling of cases next week and a doubling yet again the week after that. So there's not a lot of time. Time is very critical. So decisions need to be made very quickly because the situation we'll face in the very near future will be a lot worse than the situation we're facing today. And all the epidemic control measures are easier and will work more successfully the earlier you implement them.
So, Raina, a 5-day delay, does that concern you?
No, look, Dr. Paul Kelly is a very experienced public health physician. He's got a lot of infectious diseases expertise. And the thing is, this is a very fast moving epidemic, and the evidence is changing every day. You know, every day we're reading new scientific evidence. We're all learning about this disease. So we have to be able to think on our feet and adapt and change our guidance as the circumstances change and as the evidence changes. And I think that's the situation the government's in.
Raina, can I come back to you? We're going to have a discussion next about whether or not the schools should be shut and the implications of that. We've had 50 new cases in Queensland alone in the last 24 hours. Is it time to shut the schools?
Look, I think any measure you take to reduce the contact of people with each other will help. You won't see the impact for about 2 weeks after you take the measure. We've already taken a range of measures that will certainly help. The school holidays are coming up soon, and that will help as well. One of the strategies could be to extend the school holidays by a week, by 2 weeks. Anything helps. Any measure you can take will help. You won't see the impact straight away. It'll be in about 2 weeks after each intervention.
Okay, and for just a final comment, Raina, if we're thinking about flattening this curve, the one Norman Swan shows us, the worst case scenario, and then you flatten the curve, when will we know whether we've done enough?
Well, we can look at China as an example. So the epidemic peaked and then it came down. South Korea is also a good example. They definitely flattened the curve. So you see South Korea, Italy, and Iran all starting to take off at the same time. South Korea had a different strategy and they have absolutely flattened the curve, whereas Iran, Italy, and the rest of Europe is still surging.
Okay, so you know these numbers, you know the days. When will we be able to tell, do you think? When?
Well, we'll only be able to tell once we've seen a peak and the cases start to decline. Until then, we could just keep going on the up.
Okay.
So you can only tell once you've seen a decline and perhaps compared yourself to similar countries who are at a similar stage. But in terms of flattening the curve, you know, it's quite a medium-term strategy because even in China, the majority of the population did not get infected. So they are still susceptible. So as you do lift the measures, as the government has pointed out, there is a risk of another epidemic.
Gosh.
So we have to manage that difficult period of somewhere between 12 to 18 months, which has substantial economic implications, until we can vaccinate people and protect them.
Thank you so much for sharing your expertise tonight, Raina. Rana Mcintyre is Professor of Global Biosecurity at the Kirby Institute at the University of New South Wales. Coming up, building bridges, what the government hopes its measures will do to hold the economy and jobs together during the COVID-19 crisis.